My name is Melissa Kennemore, student F&P with the University of Memphis, here to perform a head-to-toe exam for spring semester 2025. Today's date is January the 3rd, 2025. First, I will scan the room. This is my patient, my tools, and a card for the patient to cover their eyes during the Snellen test. Ceilings, floor, walls, cabinets. Snellen eye chart. And back around my door and my patient. I have washed my hands, introduced myself to the patient, confirmed the patient's identity, provided privacy, instructed my patient to inform me of any tenderness of any of the areas that I palpate during the exam. Throughout the exam, I will examine the skin for color, temperature, texture, turgor, bruising, edema, lesions, masses, nevi, and scars, and moisture of the head, face, neck, anterior chest, posterior chest, abdomen, and upper and lower extremities. Upon inspection, the head is midline, it's neurocephalic, it's symmetric. Upon palpation, the head and the scalp are non-tender without indentation, smooth, warm, and dry. Upon inspection, the head and the scalp are uniformly pink, without infestations, without bruising, edema, lesions, masses, nevi, or scars. The hair color is blonde, the texture is fine, evenly distributed throughout except for thinning around the crown. Upon palpation, the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular lymph nodes are all non-tender and not bulging bilaterally. The ears are C-shaped, positioned symmetrically on either side of the head. If you could, please open and close your mouth. Okay. Upon palpation, the TMJ is non-tender without crepitus or without subluxation bilaterally. Please clench your jaw. Upon palpation, the motor portion of the trigeminal nerve, cranial nerve number 5, masseter muscle strength is equal bilaterally. Now I'll get you to close your eyes and tell me where you feel light touch.
Forehead, nose, left cheek, right cheek, chin.
The sensory portion of the trigeminal nerve, cranial nerve number 5, is intact bilaterally. Now if you'll smile, frown, pucker your lips, puff your cheeks, raise your eyebrows. The facial nerve, cranial nerve number 7 is intact. Facial symmetry is intact bilaterally. The skin of the face is smooth, warm, dry, without bruising, edema, lesions, masses, nevi, and scars. As I said earlier, the ears are C-shaped, positioned symmetrically on either side of the head. The skin of the ears is uniformly pink, smooth, warm, dry, without bruising, edema, lesions, masses, nevi, or scars. Upon palpation, the pinna and the tragus are non-tender without any masses. Now we'll take the otoscope and examine the ears. Left ear, right ear. Upon inspection, the auditory canal of both the left and the right ear appear uniformly pink, smooth, dry, without bruising, edema, lesions, masses, nevi, scars, drainage, or foreign bodies. The tympanic membranes both appear like pearly gray, oval, translucent, like reflex is present, without any perforations or bulging. Now, if you could tell me what I say.
ABC. 1, 2, 3.
The whisper test proves that hearing is intact bilaterally. The vestibulocochlear nerve is intact. Now, if you'll tell me if you can hear sound equally loud in both ears or greater in one.
Equal.
The Weber test proves that sound is heard equally loud in both ears without lateralization. Now tell me when you no longer hear the sound.
No longer. No longer. No longer. No longer.
All right, the Rene test is positive. Air conduction surpasses bone conduction bilaterally. Now we're going to look at the eyelashes. The eyelashes are blonde, they're uniform, they span outward, they line the upper and lower eyelids without infestations bilaterally. The eyebrows are red, coarse, symmetric, full, extend outward toward the outer canthus, and without infestations bilaterally. The palpable fissure, distance, alignment, and slant of both eyes are equal bilaterally. Upon inspection, the sclera is white without drainage, erythema, or lesions. Upon inspection, the conjunctiva is translucent without drainage, erythema, or lesions as well. Now, if you will cover your left eye, you'll read the lowest line you can read on the Snellen eye chart.
DEFPOTEC.
Switch eyes.
DEFPOTEC.
Correct. So with the Snellen eye chart, visual acuity proves that it is intact. The cranial nerve number 2 is intact. Visual acuity is 20/20 in both eyes. Now cover your left eye again. You're gonna look straight at me. Tell me how many fingers you see.
1, 2.
Switch.
1, 2.
The peripheral eye test proves that the cranial nerve number 2 is intact bilaterally. There are no peripheral abnormalities. Now, if you will look at my pen light and focus on it just with your eyes as it comes towards you. The pupils converge and accommodate symmetrically. Now, you're going to look at my pen light and follow it just with your eyes. The oculomotor nerve, cranial nerve number 3, the trochlear nerve, cranial nerve number 4, abducens nerve, cranial nerve number 6 are all intact, and the smooth extraocular eye movement is present in all 6 cardinal fields. Now I'm going to shine the light in your eye and you'll look straight at me, okay? Direct, consensual, direct, consensual. Direct and consensual pupillary light response is present. The oculomotor nerve, cranial nerve number 3 is intact. Now I'm going to take the ophthalmoscope and examine your eyes. This will be another light, so you'll just look straight at me. Okay, the red light reflex is present bilaterally. The iris, fundus, retina, and optic disc are all visible bilaterally without any abnormalities. The nose is midline, it's straight. Please close your eyes and tell me what you smell.
Alcohol.
Okay, the olfactory nerve, cranial nerve number 1 is intact. If you'll occlude your left nostril, breathe, and then your right. Nasal breathing is patent, is quiet. They're both patent nares. Then I'm also going to look at the lips. The lips are uniformly pink, smooth, without bruising, edema, lesions, masses, nevi, scars, and they are moist. There's no signs of cyanosis as well either. All right, you're going to open your mouth and say ah, okay? Stick your tongue out. Move your tongue up and down, side to side. Upon inspection, the soft palate and the hard palate are uniformly pink, moist, without edema or lesions. The soft palate and the hard palate rise, the soft palate and the uvula, rise symmetrically with phonation. The glossopharyngeal nerve, cranial nerve number 9, the vagus nerve, cranial nerve number 10 are intact. The gums, the buccal mucosa, the floor of the mouth, the posterior pharynx, and the salivary ducts are uniformly pink, moist, without edema or lesions. The tonsils were grade 2 without exudate. The frenulum was midline, the tongue is midline, uniformly pink, moist, without edema, lesions, or fasciculations. The hypoglossal nerve, cranial nerve number 12, is intact. The teeth were all present. They were white without dental caries or surface abnormalities. Normal occlusion is present. Upon palpation, the trachea is midline without any tenderness. Please swallow. Upon palpation, the thyroid gland is non-tender without any masses. If you'll turn your head that way, I'm going to palpate for the carotids. Now the other way. Carotid pulses are 2 plus equal regular bilaterally. Now I'm going to auscultate with the bell on my stethoscope the carotids for bruise. Turn your head that way for me, please. Hold your breath. All right. Hold your breath. Okay, now you can breathe. There were no bruise present, excuse me, no bruise present bilaterally. Excuse me. Also, we are going to check for the anterior chest symmetry. The chest is symmetrical without deformities or depressions. Now I'll get you to take a deep breath. Okay, chest expansion is equal bilaterally. Now you just say 99.
99, 99, 99, 99, 99.
Tactile frontis is equal bilaterally upper and lower airways. And then I'm going to listen to lung sounds with the diaphragm of my stethoscope. Say, I would just take a breath. Anterior lung sounds are clear and equal in the upper and lower airways, excuse me, and they are symmetrical. Now I'm going to listen to your heart sounds. Aortic, pulmonic, Erb's point, tricuspid, mitral. Now with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. The point of maximum impulse is the left midclavicular line in the 5th intercostal space. Now I will get you to lay down for me. Alright, I'm going to move my camera so you can see closer. While the patient is laying down, I'm going to also auscultate with the diaphragm of my stethoscope and palpate. Diaphragm, aortic, pulmonic, Erb's point, tricuspid, mitral. Now with the bell, aortic, pulmonic, Erb's point, tricuspid, and mitral. There are normal sinus rhythm is present when the patient was sitting up and laying down. There are no thrills felt while the patient's laying down. There are no heaves or lifts over the pericardium. The jugular vein is not distended and there's no pulsations there. All right, I'm going to get you to sit up. And I'm so sorry, I'm going to have you lay back down. Sorry about that. The abdomen is round, protruded, symmetrical. I'm going to auscultate with the bell of my stethoscope the abdominal aorta, iliac arteries, renal arteries, and femoral arteries. No bruise heard in any of those areas. Now with the diaphragm, I'm going to listen to all 4 quadrants. Right lower, right upper, left lower. Normal bowel sounds are heard throughout all 4 quadrants. Now I'm going to percuss. Right lower, right upper, left lower. Tympany is heard equally through all 4 quadrants. Now I'm going to palpate for tenderness. Right lower, right upper, left lower. No tenderness or masses noted on any of those areas as well. You're going to hold your breath. I'm going to palpate for the liver. All right, you can breathe. Now I'm going to palpate for the spleen. Hold your breath. The liver and the spleen are non-palpable without any tenderness or without any masses. Now I can get you to sit up. I'm sorry. All right, I'm gonna move the camera so we can see the rest of this. The patient is sitting upright without any signs of respiratory distress. No cyanosis, no use of accessory muscles, no nasal flaring, no retractions, no tachypnea, no tripod positioning. The posterior chest, to move you back here, see this? The posterior chest appears symmetrical without deformities or depressions. Please take a deep breath. Chest expansion is symmetrical. Now I'm going to need you to say 99.
99, 99, 99, 99, 99, 99.
Tactile fremitus is equal bilaterally in upper and lower airways. I'm going to percuss. Resonance is heard equally in the upper and lower airways bilaterally. Now I'm going to listen with the diaphragm of my stethoscope. Take a deep breath. Raise your right arm, right mid-lobe. Okay. Take a deep breath. Okay. Posterior lung sounds are all clear. They are symmetric in the upper and lower airways. Now, every time you feel my stethoscope, I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Bronchophony is heard indistinctly throughout in the upper and lower airways bilaterally. Now you're going to say E.
E, 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 E.
Eugophony is heard throughout equally the upper and lower airways. Bilaterally. The E does not convert over to an A sound throughout. Now you're going to whisper 99. Whisper pectoriloquy, the whisper sound is heard faintly throughout, bilaterally in the upper and lower airways. Okay, now I'm going to move the camera again so you can see the remainder of the exam. All right, let me see your fingers. Capillary refill is less than 2 seconds. Radial pulses are 3+ equal and regular. We'll move your fingers. The joints of the hands, the wrist, the elbows, and the shoulders are without crepitus, deformities, nodules, redness, swelling, tenderness throughout bilaterally. Now, if you will put your hands out, you're going to flex your fingers, extend, hyperextend, adduct, abduct, and thumb opposition. Full range of motion for the fingers. Now for the wrist, you're going to flex, extend, hyperextend. You're going to radial deviation, ulnar deviation, and then rotation. Sorry about that. Full range of motion for the wrist is present. For your elbows, you're going to flex, extend, hyperextend. Full range of motion for the elbows bilaterally. Now for your shoulders, you're going to flex, extend, hyperextend, internal rotation, external rotation, adduction, abduction, and then circumduction. Full range of motion for the shoulders is intact. Now I want you to flex against me, push against me, squeeze my fingers. Muscle strength for the biceps, triceps, and hand grip are 5 out of 5. Now I'll get you to flex. There you go. Shrug your shoulders against me. Shoulder girdle strength is 5 out of 5. The accessory nerve, cranial nerve number 11, is intact. Now I'm going to get you to do rapid finger alternation. There we go. And then we're going to point fingers together. There we go. Then rapid flip flop. Cerebellar coordination is intact bilaterally. Now I'll get you to close your eyes. You're going to tell me what you feel in your left hand.
T.
And then you're going to tell me what you feel on your right hand. Stereogenesis is present bilaterally. Keep your eyes closed and you're going to tell me what you feel me draw.
Circle. 8.
Graphesthesia is present bilaterally. Keep your eyes closed and you're going to tell me where you feel light touch.
Left arm, right shin, left shin.
Okay, light touch is present bilaterally in the upper and lower extremities. Now we're going to test vibratory sensation. You can open your eyes. Oh, and the skin of the extremities is smooth, warm, dry, without bruising, edema, lesions, masses, nevi, or scars. So we're going to tell me if you feel vibration on your wrist. Ready?
I do. Feel
All
it.
right.
I feel it.
All right. And the proximal ulnar prominence.
Feel it.
Okay.
Feel it.
Vibratory sensation is intact bilaterally. Now we're going to do deep tendon reflexes. Brachioradialis. Move your arm this way. Biceps, triceps. Brachioradialis, biceps, triceps. And do patellar. Relax your leg. Achilles, Bambinsky's. Deep tendon reflexes are present bilaterally and they are equal bilaterally. Now I'm going to feel the pulses of your feet. Dorsalis pedis pulses are 2+ and regular bilaterally. Posterior tibial pulses are 2+ regular bilaterally. The capillary refill of the toes is less than 2 seconds bilaterally. Now, if you'll move your toes, all right, your ankles up and down, yep, and your knees, and then your hips, move them in and out. There you go. The joints of the toes, ankles, knees, and hips are without crepitus, deformities, nodules, redness, swelling, or tenderness. Now for your range of motion for your toes, you're going to flex, extend, and you're going to adduct, abduct. Okay, full range of motion for the toes is intact. For your ankles, you're going to dorsiflex, plantar flex, inversion, eversion, rotation. Full range of motion is intact for the ankles. For your knees, we're going to test that full range of motion here in just a minute. You're going to dorsiflex against me and then push plantar flex against me. Ankle strength is 5 out of 5 for the ankles. Then you're going to adduct against me, abduct against me. Hip strength is 5 out of 5. And then you're going to push it. There you go. Good. And knee strength is 5 out of 5 bilaterally. Now, I'll get you to step down for me. All right, the curvature spine is as expected without any nodules, masses, tenderness, or signs of scoliosis. Now you're going to stand up, and what we're going to do is we're going to lumbar flex, and you're going to extend, hyperextend, left lateral, right lateral, and then rotation. Lumbar range of motion is fully intact. Now for your cervical spine, you're going to flex, extend, hyperextend, left lateral, right lateral, and then rotation. Cervical motion, range of motion is fully intact. Now we're going to do our hips. So you're going to flex, extend, hyperextend, abduct, adduct, inversion, eversion. Now with the other leg, you're going to do the same thing. Flex, extend, hyperextend, abduction, adduction, inversion, eversion. Full range of motion is intact bilaterally for the hips. Now for the knees, let's get back over here. You're going to flex, extend, hyperextend. The other leg, you're going to flex or knee, extend, and hyperextend. Full range of motion for the knees is intact. Now you're going to put your feet side by side, your hands next to your side, close your eyes, patient maintains balance. And now you're going to open your eyes, you're going to jump on one foot, and then the other foot. Patient maintains balance while hopping. And then if you'll walk heel to toe, and then back, heel to toe, The gait is tandem and it is regular. Patient maintains balance. This concludes my 2025 head to toe assessment. Thank you.